I wish, honestly, that national healthcare policy had headed in some direction more like this. When people ask me what we ought to do or what my reaction to this whole bill is, I sometimes start by saying, you know, in a dead end, full speed ahead is the worst option. That's what I think we did. My own view is that we could hardly have built a healthcare system in this country more guaranteed to produce excessive costs. We pay people for volume, not results. Worst of all, we make healthcare appear free through third-party reimbursement. I guess this is all very familiar story to you now. And I've been urging people that whatever else you think or say about it, don't call this reform. Don't call this reform. It didn't reform anything. It took the form we had and blew it up to poster size. And I'm afraid by perpetuating the drivers of higher cost is setting us up for more disappointments in the future. The assignment, at least to touch off the discussion, as I understand, the assignment is to talk about what this canon looks like from the receiving end. And work in progress is the only way to describe anything I have to say yet. We're still, we're only beginning really to grapple, reeling might be the term, with what this will mean at the state level. But let me give you at least the first glimpse. Talk dollars and cents first of all. Coming up the elevator, someone said that there might be people here who actually think of this as some sort of a subsidy or a boon or a blessing to states. Let me disabuse you if you thought that, because in addition to the predictably much higher cost to the federal treasury of what has been done here, there's a huge mandated tax increase at the state level. And I'll just speak to the likely experience of our state.
Second downside risk is basically the spinach and dessert problem. That the healthcare bill has got some dessert in it, right? Things that are attractive, right? I mean, you know, budget geeks like me, some start talking, you know, billions of dollars, trillions of dollars, blah, 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 right? So, you know, keep in mind the healthcare bill, as scored by CBO, will expand health insurance coverage to 31 million people. And, you know, there is a lot of good in that. There's a lot of dessert there. The spinach, the unpleasant part, are the various things that are done to pay for it. And one of the challenges going forward is the extent to which we believe that Congress will actually allow the spinach to go into effect. Right? It's easier to imagine the ice cream persisting than the spinach. Right? We have an example of that with the cuts that have been scheduled in Medicare for some time for doctors, for example, where it's hard to do them, and it may even be hard to find pay-fors, may just get extended. And you know, you have to worry about whether all the provider cuts will actually happen as scheduled, whether the Cadillac tax will go into effect as scheduled.
The second bullet there talks about administrative capacity, and that's not a sexy, interesting issue, but I've got to tell you, it is very, very significant for states, because I'm not sure at the administrative level people understand how lean we are in terms of resources, in terms of talent. We've got talented people there, just not a lot of them. And the reason is, and it makes sense, when you have a limited resource environment, which you have to balance at the end of the year, you don't have a political constituency for administrative, accounting, and all kinds of things like that. I always joke, budget offices, we don't have a constituency group. So where do you get cut disproportionately? Administrative areas. I've been on conference calls and in meetings with the federal folks, and I have tried to explain, you do not understand, because of the resources at the federal level you're used to, it's just a lot bigger than a state, you cannot possibly understand unless you go into the state capitol and see how lean the administrative capacity of states are. And that's a big concern about implementing this major health care reform.
Beginning in 2014, every adult and child in America must have health insurance or pay a fine for going uninsured. If health insurance is deemed unaffordable for someone at your income level, the government will pay you a tax credit to help cover your premiums. If you get such a credit, your employer is going to have to pay, and again, this was discussed, thousands of dollars in penalties, assuming the employer has more than 50 employees. I'm going to tell you how this is going to radically alter the employer-employee relationships that are in ways that I think are enormously destructive. you'll find all sorts of other strangenesses in here. At times, adding another subsidized employee is going to increase your penalties $2,000. Other times, it's going to increase it $3,000. Other times, it's not going to increase it at all. In these rare, strange, I don't know how rare they are, no one knows how rare they are, but in strange circumstances, it could increase it $42,000 or more. We don't know, but it's going to be all over the map. Other times, it's not going to be adding another subsidized employee, it's just adding another employee. So I go out and hire you and I pay you a nice high income, so I'm covering your insurance, not the taxpayer, but I've created a new job. I could still get hit by that $42,000 penalty, or the 2 or the 3 or the 0, depending. This thing never, ever gets intuitive. I've been staring at it and talking to myself out loud for weeks. It doesn't get any clearer.